Well, hi, here we are. I'm Dr. Marshall Partington here at Partington Plastic Surgery Center in Kirkland, Washington. And we're about to do a rhinoplasty on this lovely young lady who is actually Miss Canada. So she's really an international supermodel and beautiful, obviously. She's had previous rhinoplasty surgery, and she's been quite happy with that in the past, but there are just some minor changes that she'd like to make. And we've negotiated, kind of drawn the line on some things, and agreed to move ahead with other things. And basically, the surgical plan is she has a very small, I've injected her nose already, so it's a little different from what it's going to look like. But she has a very small bump on the dorsum of her nose and back of her nose, which feels like a little retained cartilage. So we're going to try and smooth that out. Okay. Number two, her nose still has a little more width than she would like here in this midsection and lower section. And to deal with that, we're going to perform osteotomies where we go in the nostrils and mobilize these bones, what you hear about breaking the nose, and then bringing the bones in a little closer to give her just what she refers to as a more feminine look. She's very feminine looking. But a little bit more of that refinement of her dorsum and width. And then lastly, she'd like to have her nostrils just slightly closer together to decrease the width of the base of the nose. And so we will accomplish that with small incisions at the base of the nostrils and bring those in just slightly. Everything has to be just super slight. Yeah, so she's numbed up now and nicely asleep. As you can see, she's under conscious sedation. We've got a little oxygen in her nose here, in her mouth rather, she's breathing. That leaves the nose free. And we're just about to get underway. Thank you.